Hi, I'm Bob Clark from Williams Dental Lab, and today I'm here with Dr. Frank Sullivan from Louisiana, and I have a couple questions about provisionalization, as I feel that you do some things that are really unique in the practice. I've asked you before about provisionals and how they go from a speed standpoint, whether you have a lot of cleanup and all that kind of stuff, and your information is really unique, and I'd like to talk about it a little bit.
Well, Bob, what we do is we're real big on the dual arch stent, and I want to do things as fast as possible. If I've been prepping the mouth, and sometimes I tend to fondle the teeth a little bit, and some of the ladies in my office are always kind of like, "Come on, let's go, let's go." So we make up a lot of time in the temporization phase of what we do. The key here is speed, and we take two guns. We use integrity. So I have a gun, and my assistant Erin has a gun. We have a little timer right there, and she has the dual arch stent in her hand. We push go, okay? And our goal is we want to get this in the patient's mouth within 30 seconds. Because remember, the more flowable the integrity is, the easier the cleanup's going to be.
So not everybody knows this, and I don't know why there's a little miscommunication, but I hear this from you, but other people will tell me, we have a lot of cleanup, there's a lot of flash, and I'm thinking, we do everything the same for you as we do for everybody else. When I talk to you about it, the one thing you do is you go really fast.
And there's a couple of key components, and speed is number one. A good stent is definitely important because I want good margins. I want those margins at that stent in there where they get around that wax. You know what I'm saying? So let's just go through it. All right, so we hit the timer. As soon as we hit the timer, we're counting. We're counting out loud usually, 5, 10, 15, 16, 17. And I'm in there with the gun, and I'm putting it all over the lower and the upper arch, and Erin's over there putting it in because we're using two guns because we can deliver more, and I don't care how much we put in there. We can put a bunch in there. So many people are about, you get a lot of flash, it's going to take a lot longer to clean up. So within 30 seconds, it's in the patient's mouth. As soon as it goes in the patient's mouth, we start massaging around the soft tissue. What we're trying to do is we want to force all of the extra material into the vestibule or into the tongue area. Okay? We leave it in there for a solid 4 minutes.
4 minutes?
4 minutes.
Wow.
Okay? Because when we take it out, there's no cleanup.
Well, the flash that's up past the vestibule, you just flick that off and it cuts right at the sharp margin area?
Bob, when I tell you, we grab it over here and it comes out in a horseshoe all the way around. Okay, we take it off the palate and then we go to the bottom and do the same thing. And in less than 10 minutes, we've got them polished. If there's any type of minor bite adjustments, we've usually even done that. 10 to 12 minutes from start to finish, and we're through.
Frank, this information is going to help a lot of people. I really appreciate it. Thank you very much.
You're welcome.